Okay, so let's look at what preload is. Preload is just, you know, the good example they give you in the book is talking about a rubber band. So preload is the stretch of that heart. It's the stretch of that heart right before it contracts. So preload is how far you have to stretch back. So if the heart stretched just a little bit, then that's not going to be a big contraction when we let go. As of where if I stretched it way back and then let it go, that would be a huge contraction, really hard. So that's all preload is how much am I stretching? Stretching out, feeling those big ventricles right before we contract. So contractility is the actual force of that heart, the ventricles contracting and pushing blood out. Whereas afterload is then the pressure of the blood being pushed against whatever's in front of it. So whether it's going into the lungs, the pressure in the lungs, or if it's the pressure outside. So if you have hypertension, then that afterload is going to be really high. There's a high pressure that it's having to push against those vessels. Not good. Now, you can stretch the heart too much. You know, really, there's a point to it. Overstretching it does not mean a better contractility of the heart. You overstretch it and it can get floppy and not contract as well. So there is a limit to that preload.
The amount of blood ejected by the heart, called stroke volume, is affected by three factors: preload, contractility, and afterload. Preload is the amount of tension, or stretch, in the ventricular muscle just before it contracts. The more blood entering the heart, the more the ventricle stretches. Contractility is the force with which ventricular ejection occurs. The more the ventricle is stretched within limits, the more forcefully it will contract. This is known as Starling's law of the heart. The amount of blood in the ventricle at the end of diastole determines how much the ventricle is stretched. The more blood returned to the heart each minute, the more forcefully it will contract. However, too much blood can overstretch the heart's muscle, causing it to lose elasticity. The forces the heart must work against to eject its volume of blood are called the afterload. Such forces include the pressure of the blood in the arteries. An increase in afterload, such as high blood pressure, opposes the ejection of blood from the ventricles, which decreases stroke volume.
So it decreases its ability to push blood out. Again, not good having high blood pressure. Okay, so cardiac output equals what? What were the two things that we multiplied times each other to get a cardiac output? Heart rate and stroke volume. So A. Okay, last little concepts here, talking about our two-sided pump failing. So if the left ventricle fails, so that's the left side. If this side fails, that pumps out to the body, and this is your most common one that will fail. Jason.
I moved because it's
So left side, if it fails because of high blood pressure, because what happens is if after the afterload, it pushing against that high blood pressure for a long time, it starts to get bigger and bigger and more muscular, which isn't always good because it stretches it more and more and more because it's trying to push against that high pressure, as in high blood pressure. After a while, you know, you stretching a rubber band, it gets floppy and loose and it can't contract as well. So it starts to fail. Jason.
Okay. I have a friend who has like an enlarged heart, and he said that's bad. Like, why is that?
What happens with the rubber band, guys, when it's really enlarged? It gets floppy. It can't contract anymore. If you overstretch it, it can't contract. So it gets big, it gets floppy and stretched out, we can't contract. So if this is not pumping out to the body anymore, blood starts to back up. So if blood is backing up in the left ventricle, it starts to go backwards and pull in other places. So left ventricle failure will back blood up into the lungs. So everything behind it. When we do our pathway through the heart, this will make more sense and it will click for you because you'll know the pathway of blood, and then we'll go backwards with failure. So blood starts to pull in the lungs. What do we see patients do then? Huh? Yeah, that's real common. So if you have left ventricle failure, they start to cough, they have shortness of breath. They say, I can't breathe, because blood is pooling into the lungs. Right ventricle failure, so what will happen again? Commonly, left ventricle failure happens because we have lots of people with high blood pressure. Then we will have the lungs backing up with blood. Then eventually we'll have right-sided heart failure. Because think about it. This one is pumping to the body, and it starts to get tired and fail because it's pumping against pressure in the body because of high blood pressure. Blood pulls back. We have blood in the lungs. Now this side is pumping against the lungs, which are full of blood now. And it's a higher pressure, so it fails. This one will fail, and then this one will fail. So now we got right-sided failure. What do we start seeing? Where does the blood back up now? The whole body. Yeah. So golly, that really compounds the problem because we're trying to push against and we can't. This one fails, and then we get all this pooling of blood, and we're still trying to push against. So what you'll see with these people with right-sided failure is when it fails, you'll see blood pooling, and you'll have generalized edema. So you'll have swelling all over, and that's right-sided. Huh? No, it's still moving, but what happens is when pressure's really, really high, and it's pushing against vessels, fluid doesn't stay in the vessels, so it goes into the tissue, and you call swelling. That's what the edema is swelling. You can have an enlarged liver because, again, blood is pulling. You have lots of little sinuses in livers, and they start filling with blood. Spleen, bellies can get really big. This jugular vein distension is these jugular veins. Normally you don't see them. When someone is sitting up at a 45-degree angle in a chair, you don't see those veins enlarged. But on someone that has generalized edema, has right-sided heart failure, you will see them. They'll be really, and we actually, nurses, we measure them and tell them, it's 2 centimeters of jugular vein extension because I can actually see how far up it goes, that it's actually pushed out. Yes?
Do you know what angioedema is?
Yes.
What causes that?
You need to look it up.
Really?
Look up, and we've got Tabor's, Google, and look up what it is, and then get back to me. Especially Monday, because we're going to be talking about that stuff. Okay, so pulling in the abdomen, jugular vein distension, all heart failure things going on. And again, when we look at the actual flow of the blood through the heart, you'll understand those things a little better and why all those systems are failing.